Welcome to An Hour to Give, and this time every week we get together and speak about philanthropy and community and volunteerism. And this week I'm thrilled we're speaking to the Ottawa Hospital and representatives, and particularly in gay men's health. And I'm joined by Dr. Paul MacPherson. Welcome to the show.
Oh, thanks for having me.
I'm so excited to chat with you. We had a chance to chat last year, and it was so interesting to me how the Ottawa Hospital once again is leading the way. Can you give us a bit of an update?
Sure. I'm very excited and proud to say the Ottawa Hospital is really leading in this area. The main issue here really is population-specific healthcare, and our focus is gay men's health. So, I mean, as you know, healthcare is universally available to everyone in Canada, which we're very fortunate for. But how we deliver healthcare and what the healthcare issues are for different populations, of course, differ. So finally, we're all coming around to the idea of population-specific healthcare. I think we got on board with women's health a few years ago, and realizing how successful and important that is, we've now moved on to think about other populations. So our focus is gay men, and this is a group that has really largely been ignored in healthcare, except when it comes to HIV.
Right.
And while that's been a very important healthcare issue, our health is about more than just HIV. I think gay men in the healthcare have also been heavily sexualized. I think a lot about just how we have sex, but healthcare is more than that, and we need to focus on more than that. So the Ottawa Hospital has indeed decided to make this a priority and look at gay men and gay men's health and how to deliver that. And we will be the first, certainly in Canada, and I might say further than that, in taking this on as a population-specific health focus.
Can you share with us a little bit about the research chair in gay men's health?
So this is something we're actually currently raising funds to establish. As I said, there's been a lack of focus on healthcare for gay men, so we're hoping to put a research chair in place so that this will be continued. The work that we're doing will continue to happen to help identify what the main healthcare issues are and how we can best deliver healthcare to this population.
And how much is required to establish that chair?
Well, we hope to have an endowed chair, meaning it's a chair that will go on, indefinitely, that we would recruit someone into that chair and then be able to continue the work. So we're hoping we need to raise $1 million.
Well, it's such a great opportunity to be speaking about this. Of course, this is Pride Week in Ottawa, so it really does make sense for the Ottawa Hospital and, of course, yourself, Dr. MacPherson, to be talking about gay men's health and this exciting research chair.
Yeah, we're very excited and hoping that we can be successful in raising the funds to establish the chair.
It's really exciting. Tell me a little bit about, when we've had opportunities to chat before, I've just met some incredible people through this process. Tell me a little bit about sort of somebody that you would see that would, come to you and maybe, hasn't had an opportunity to speak about their health for maybe decades.
Oh, yeah, this is often something I see in patients who come into the Ottawa Hospital. I think, sexual minorities are often just kind of overlooked in healthcare. Partly maybe with good intentions, physicians, nurses are very dedicated to treating everyone the same, which is important, but at the same time, we need to recognize our differences as well. So sometimes sexual minorities are overlooked. So we have patients coming in, and it's not uncommon for us to talk about something, and these patients to say, this is the first time someone's ever asked me that, or this is the first place I've ever felt comfortable discussing that. So sometimes people just want to be asked, and it's exciting to be able to provide that level of care.
Do you think, Dr. MacPherson, that, maybe people have held this information close to them, that men are not revealing their sexuality for fear of maybe being judged or are not being treated with respect?
Absolutely. We actually did a survey of gay men in Ottawa a couple of years ago, and we asked that question, are you out or have you disclosed your sexual orientation to your primary healthcare provider, either your family doctor or nurse practitioner? And actually, a quarter of the men indicated they had not told their primary care provider about their sexual orientation. We didn't in that questionnaire, we didn't get into reasons, but in talking to people, there's often several reasons that come forward. Sometimes men just don't think it's relevant to their healthcare, so we have some educating to do there so that people understand how their sexual orientation will influence their health and healthcare delivery. But other things people bring up is, as you mentioned, anticipating negative comments or negative reactions when they disclose it. I mean, we do live in a thankfully accepting society, but acceptance of homosexuality is certainly not universal. And the other thing we find is, gay men are often stereotyped. Mm-hmm. And so men are afraid to disclose their sexual orientation because then they assume they're going to be labeled with all these stereotypes. Being feminine is bad, but that many gay men are not at all feminine, right? Or that all these various stereotypes that come with being gay, which are often just not applicable to the majority of men.
And I think it's great. We're speaking a lot about physical health. Can you share with me a little bit about the impacts on maybe gay men's mental health?
Oh, thanks for bringing that up. Mental health is a big issue. In that same study, we saw rates of depression and anxiety, the point prevalence of anxiety and depression, upwards in around 15%, which is much, much higher than the sort of general population averages. And I think this comes from, living in a society where you're never sure if you're really going to be accepted. I think one thing that people often forget is that as sexual minorities, most of us, although probably not all, but most of us are born into heterosexual families. And as we grow up and become aware of our own sexual orientation, we start to realize we're not quite the same as our family. And that really can be really disconcerting for a young adolescent, feeling that, I may not entirely fit, or feeling like they may be letting their family down. All of our parents usually will say something about, when you grow up and you get married and you have kids and all these things, which is very natural things to do. Mm-hmm. Realize you may not actually fulfill your parents' expectations. And again, as a young adolescent, that can be kind of worrying. And so people can develop a fair bit of anxiety, what we call, just social insecurity, wondering all the time, are people going to be accepting? Are people going to be okay with this? If I disclose this, how am I going to, what's kind of reaction am I going to be facing? We found a lot of men are not out at work, for example, often related to, will this affect my career? How will my coworkers react to this? So there is a fair bit of mental health issues. The other one we know not a lot about, we need to learn more about, is the effects mental health as gay men age and the isolation that often comes with that. If you don't have children, a lot of times as people age, they become increasingly isolated, and that has, significant impacts on mental health as well.
Dr. MacPherson, I have a funny feeling there, and I'm hoping someone's listening right now, and they're thinking, this is what I've needed to hear. I've needed to hear that, there is an opportunity for, me to have my health cared for as a gay man. What would you say their next steps would be?
I'd honestly talk to the family physician. Most physicians we talk to, and when I say most, I mean very much the majority, are very eager and want to provide optimal health care to the patients and want to provide really good health care for gay men, lesbians, any sexual minority. But they can't do that if they're not informed. So talk to the family physician. If by chance you encounter a physician or nurse practitioner that's not open, find a new one. Mm-hmm. Find someone who you can talk to. Come to the Ottawa Hospital. We'll do our very best to link you up with the people you need to be linked with. The most important thing is don't remain in isolation. people forget that there are many, many other people out there just like them, and we can make healthcare accessible for them.
Is this a dream come true for you that we'd even be having this conversation today?
Good question. I guess it is, indeed. I mean, when I was growing up, this is not something that would have been talked about, and I'm very excited to be part of this. And as I said, very, very proud of the Ottawa Hospital for taking this on and promoting. I'll be honest, when I first brought this forward, I fully anticipated, well, that's not really where we want to go. This is not something that Ottawa Hospital wants to be seen as. I thought, I know people are, the Ottawa Hospital is going to want to be associated with sexual minority health, and I couldn't have been more wrong. It has been everyone from communications to top leadership have been 100% behind this.
Amazing.
So it is a very, very exciting.
So once again, the Ottawa Hospital is a leader, as we know it to be.
Absolutely.
Fantastic. Dr. MacPherson, will you stay with me? I've got more questions for you, and if you stay with me for another segment, and we'll be back on An Hour to Give. We're chatting about gay men's health. Of course, it's Pride Week in our beautiful city, and we're talking with Dr. Paul MacPherson from the Ottawa Hospital, incredible physician. And Dr. MacPherson, before the break, we were talking about the fact that really this is a dream for you. You never really thought you'd ever hear this kind of program taking off, and not only that, but us talking about it on radio, which is great. Tell me a little bit about why this is so important to you.
Well, I mean, I guess other than being a gay man myself, and so therefore this obviously touches very close to me and to many of my friends. I guess to answer your question, I just reflect back on why I came to medicine. Initially, I was actually a researcher. I was what they call a lab rat, and I was actually doing research in HIV, specifically just bench virology. And this was in the late 80s, early 90s, and at that time in medicine, the outcome for people with HIV was well, let's just say, was not the best, right? And so I decided at that point, being a gay man, being a virologist, that I would kind of roll up my sleeves and try and wade into the clinical aspect to see if I couldn't make some kind of difference, or at least provide, some support, or do my part at least. But then as the years went on, and now very happy to say HIV is a very manageable infection, and many people call it a chronic illness, although most of my patients with HIV aren't even ill. They're fabulously healthy. And I guess even that was part of the evolution as we, brought HIV under control and viral loads were suppressed, and people were then living very, very healthy, quote unquote, normal lives. All the other things sort of started to come out of the woodwork, right? The mental health issues, the isolation, the uncertainty, the interactions with healthcare system that wasn't really perhaps optimal, the stigma, the stereotypes, all these other things started coming out, and I started thinking, there's way more to this than we first thought about, and how are we? What are we missing, and how are we delivering the healthcare? And so this has been a bit of a journey for me, also, in just learning about the healthcare issues and how to deliver better healthcare.
I think from what I understand too, one of the roles as part of this research chair in gay men's health would be also that training and education for other healthcare providers, so they can offer the most positive support that they can.
Oh, absolutely. What we hope is that this research chair at the Ottawa Hospital will be a resource for not just Ontario, but even nationally or beyond that we will become a real center for populations with healthcare, and gay men's health being right in there. We hope this research chair will be multidisciplinary, so that we'll be able to touch on all the things that we've talked about so far, and more, that probably things we haven't even uncovered yet. But that we'll have a very broad view of health, as we say, not of illness, but of health as living well, and as I say, be a resource for other healthcare professionals and other healthcare institutions.
Are there healthcare professionals now that may reach out and say, I've got this situation and, how should I deal with it? Is that kind of communication happening?
Well, they're certainly welcome. I mean, as you know, I'm an infectious diseases specialist, so me specifically, there may be issues that I'm not able to deal with, but it can probably help link people up with other healthcare professionals who are knowledgeable in gay men's health and can be of assistance to them. But I mean, that's part of what we're trying to do, right? Is build that kind of center and knowledge where, regardless of the question or concern, we will be a place that our healthcare providers can turn for support and knowledge.
I know you're inspiring lots of people today. If someone's listening and they wanted to give a gift towards this research chair for gay men's health, I'm assuming they would reach out to our friends at the Ottawa Hospital Foundation.
That's right, and we'd be so very honored to receive any gifts to keep this project moving forward. People can contact the Ottawa Hospital Foundation and make a donation specifically to the research chair in gay men's health.
Can we go back to talk a little bit about the HIV piece? So, you said right off the top, sort of it was only focused on HIV when it came to gay men's health. And of course, that research is still underway. What other research are you finding to be the most effective?
I hesitant to say that there's not a lot of other research being done. As I say, HIV is certainly, don't want to take away from that in any way, shape, or form. Very, very important and very important part of gay men's health. But continues to be the main focus, I think. Although I guess I should say I am speaking to you from Toronto, where I'm here at a meeting for the papillomavirus and how that relates to gay men's health. That is an interesting area. When we talk to gay men and to healthcare providers, most people, and probably 80 to 90%, don't realize the human papillomavirus is a gay men's health issue. Most people associate human papillomavirus with women and cervical cancer, and vaccine for HPV, the Gardasil 9 vaccine, is being really indicated for women. And forgetting that this is really a men's health issue as well. So I'm sitting here in a meeting in Toronto where we're talking about this and trying to move that research piece forward as well.
It's really exciting because I think the more that, we share obviously publicly, but the more that is uncovered and we're able to share with people, then of course lives are changed and essentially lives are saved.
I hope so. Lives are even just, made better, where people, sexual minorities and gay men, know that they have a place where they can connect for their health care and get health care that we understand where they're coming from.
Can you dream for me, Dr. MacPherson, and take me 20 years from now? Let's pretend it's 20 years from now and you want to see what's happened with this research chair. And if we had a crystal ball, what's your dream?
Oh, I would love to see at the Ottawa Hospital and the Ottawa Hospital Research Institute a Center for Sexual and Minority Health, where there'd be experts in multiple disciplines of medicine with expertise in delivering health care specifically to gay men, but also to lesbians, to bisexuals, transgendered, all the sexual minorities, and understanding all of our differences and areas where we're the same. And we could have a center to provide healthcare and to provide resources for those healthcare providers around the province, if not across the country.
And we've talked about obviously the research chair and all of those amazing things that would go towards that. What are some of the barriers you see?
Well, I think a lot of it right now is just lack of knowledge and lack of awareness. One of the questions we get a lot from family docs, we talk about, what about gay men's health? And then repeatedly I hear things like, oh, absolutely, very important, would love to provide specific health care to gay men. What is that exactly? Tell me what I need to do. Mm-hmm. So it's really even, our research is really even at that stage of what, identifying what the healthcare issue are, both from physicians and healthcare professionals' point of view, but also from the patient's point of view. What is it that they want? What are their health concerns? What is it that they want us to pay attention to? So that's also important. And these are things we still have to learn.
For sure. And I think, especially, I love that you're joining us during Pride Week. I think that's a really great opportunity to bring attention to it and really share, not only the opportunity for people to give to the actual research chair, but to maybe educate those in their family and know that these kinds of things are on their way and some things are already here.
Yeah, absolutely. We will have a booth at Pride. So hoping that people will stop by the TOH, the Ottawa Hospital booth during Pride and chat to us.
And what would they find at the booth, Dr. MacPherson?
Those of us willing to talk to them and hear their stories and what their healthcare looks like and how they want it to be, and also, obviously, opportunities to donate to the research chair to move this forward.
That's exciting. When you're chatting with people, are you finding it's young people or maybe people that are a little bit older they're having the most questions?
No, excited to say it's all age groups.
Mm-hmm.
Young guys are coming out wanting to know, about their healthcare, where to find healthcare, where's the best place to go, and middle-aged, older guys, all with their, different health concerns, their health questions. I wouldn't say there's any age predilection at all.
That's great. That means you're hitting all generations, and you inspire me so much. This is the second year in a row that we've had an opportunity to speak about gay men's health and the incredible strides that are happening at the Ottawa Hospital. I could not be happier to know that this is in our very own community and that you are leading the way, Dr. MacPherson.
Well, and thanks to the Ottawa Hospital, and thanks to you
you're so sweet.
Having this.
Well, next time, let's make sure we get together again for next year's 2020 Pride and share all the advancements that you've made in the upcoming year. And we're so grateful to have you on An Hour to Give. We're going to be chatting a little bit later with Tim Kluke and Annie Grenion, and we're going to be chatting about some of the other things that are happening at the Ottawa Hospital and how to help out. So we hope you stay with us on An Hour to Give.